All right, guys, so this is the page that I sent you the link. So it's going to take you to this page. So first we're going to scroll down and look for that blue Medicare button. So once we get there, we're going to hit apply for Medicare only here. So we're going to hit that. This is just some stuff about I understand that I'm putting in the correct information, that Social Security is going to verify that information, that type of thing. So, always put in what's correct and true to your knowledge, and then we're going to hit next. All right, so next you're going to either sign in or you're going to create a My Social Security account. So for this, the person I'm signing up, she already has a My Social Security account. So what we're going to do is we're going to read this, and then we're going to say, it's telling us it takes about 10 to 30 minutes, usually more 10 to 15, but we're going to hit Start New Application, and we're going to get started. All right, so who is completing this? So I'm going to say I'm applying for myself. So the person I'm helping is right here with me, and she does have a My Social Security account, so I'll hit yes. Now, if you don't, you'll hit no, and you'll be able to create one. I can also send you a link on how to create one of those. It's not too hard, but she already has one, so we're gonna go back and say that yes, she does have a Social Security account, a My Social Security account. And then we're going to hit next, and then we're going to log in to her Social Security account. So we're going to type that in here and sign in. All right, so first thing it's going to do here is send us a code to put into that email address. So it's going to send a security code to that email address, and I'm going to go look at the email here, get that code. It's going to expire in 10 minutes. It's just a two-factor authentication. So once we get that code, we're going to put it in here and hit submit security code, and that's going to let us in. So looking for the code now at that email address. All right, got the code. Now we're going to hit submit security code. Great. All right, so you've successfully created or signed in this case, signed into my Social Security account. So some of this was already set up, and so we're going to hit gender female because that's who's signing up. It's going to ask you, are you blind or do you have low vision, even with glasses or contacts? We're going to hit no for her. During the last 14 months, have you been able to work because of illness, injuries, or anything like that? Nope, she's been okay, so we're going to hit next, but obviously you hit whatever is right for you. Next after that, you're just going to put in your street address. So it's pretty self-explanatory here. So we're going to put in street address. We're going to put in city, state, zip code. We're going to put whether we live at this address, which she does. So we put yes. Put a daytime phone number in here. So whatever number is best to reach you at. We're going to also choose the best time to call. They give a few options here, 9 a.m. to noon, noon to 5, anytime between 9 and 5 p.m. So just in case they need to call you to verify anything, you give them a time to call. Also, put an email address in here that you want them to send the verification of your enrollment to, so one that you actually check and use. So it's going to make you put that in. It's going to make you put it in again just to confirm it. So we'll put those two email addresses in. And then next, our preferred language. For us, it's English, but you put whatever your preferred language is. And then next is going to be citizenship information. So place of birth. Where were you born? So she was born in Nashville, so that's what we're going to put here. But you put whatever you put. You're a U.S. citizen, yes. And she was a U.S. citizen born in the U.S., so we're going to hit next. This here, so did you wish to apply for Medicare only, but not for retirement cash benefits, or in other words, Social Security? So for this, we're only applying for Medicare, so we're going to hit yes and no. If you want to see that again, like I said, for this, if you are applying for Social Security as well, you're going to want to hit no here for the first question, and it's going to ask you for some additional questions because it's going to be applying you for Social Security as well. But for this, we're just using it for Medicare only, so we're going to hit yes. And then for are you already enrolled in Medicare under a Social Security number other than your own, we're going to hit no because we're not, and most people aren't either. So again, we're going to hit yes for Medicare only, and then no because we haven't enrolled under Medicare with a different Social Security number, and most people have not. So we're going to hit yes and no here, and then hit next. All right, now this is your re-entry number. So what you'll want to do here is write this down. This number is going to allow you, if you can't finish the application now, to come back to this and restart the application where you left off. So go ahead and jot that down. We're going to go ahead and jot it down here. Even though we're going to finish it out ourselves, it's still something good to have. So we'll jot that down, and then once we get that, we are going to hit next. So this is just saying this is the date that we're applying, and this is when they're receiving this application. We're verifying that, yes, it is 8/23. And then we're going to hit next here. All right, so this, again, we're only enrolling in Part A. So we're going to hit no because she has a group employer plan that allows her to skip or to delay Part B enrollment. For most of y'all are going to enroll in Part B here, so you're going to want to hit yes. But in this situation, we're going to hit no because she's got an employer plan with over 20 employees that's creditable coverage. So we're going to hit no, just enroll her in Part A and use that Part A as a backup hospital insurance. But you can see here, it's telling you, hey, look, you sure you don't want to enroll in Part B? Because if you don't, there's late enrollment penalties, which is true. But if you have group health employer insurance that has over 20 people that you're happy with, you can just use that and enroll in Part A only and just use it as backup hospital insurance. So again, for her, we're just delaying Part B. And does she receive Medicaid? No. So we're going to hit no there. If you do receive Medicaid help, then you're going to hit yes. All right, so we're going to hit next. All right, you cover under a group health plan. It's asking this because we are skipping Part B. If you're not skipping Part B, probably won't ask you this, but we're going to have to put that group health plan information in, when it started, that type of thing, because again, that's the only way we can enroll in Part A only and skip Part B without a late enrollment penalty, because she has that group health insurance that she's keeping. And it's creditable as well, which again is over 20 employees at the group. So we're just putting in the dates when that started. So not much to see here, just started in 2011. So we're putting the start date of the group health insurance, and it has not ended. And when did the actual health insurance start? So that was asking about employment information. Now it's wanting to know, when did the actual health insurance start? Did it start immediately? Was it 90 days after? It's probably okay if you get this a little bit off. They're just wanting to know that it's not something that started just, last week or something. So being that this started 10 years ago, we're talking about 2022. This is not going to be a problem. Okay, this is remarks here. So now this is where you can request a date for your Medicare Parts A and or Part B to start. So you can request a date as far as 90 days out or as little as a month ahead of time. So I always tell people to do this enrollment for your Part A and or B Medicare 3 months before your 65th birthday. That way, when your 65th birthday comes along, your Medicare is going to start right away. So it's going to start the first day of that 65th birthday month, as long as you've enrolled in those 3 months prior to you turning 65. So if you've done this little 10-15 minute thing in those 3 months prior to 65, you don't even really need to put anything in the remarks. It's just going to start on the first day of your birthday month. So since that's the case with her, we're just putting in that we think this is when the private insurance started, but we're not totally sure. So we hit next here. Now this is just going to be verifying all the information that you put in is correct. So it's just giving you a quick look at all the things you've typed in. So you want to look this over really good, make sure it all looks correct to you, all looks accurate, that type of thing. And if it does, then we're really just about done. So didn't think it was going to be that easy to enroll in Medicare, did you? I know I didn't. But yeah, it's really not bad. So after reading this here, you can see your remarks there. So you're just going to read your little signature agreement. You say, I agree with the electronic signature above. And then when you're ready, when you've found that everything looks correct to you, you're going to hit Submit Now, this blue button here at the bottom. Still looking it over, making sure everything's correct. All right, so thank you for applying for Medicare Online. Here's your confirmation number. So write down that confirmation number. So generally, your Medicare card is going to take 4 to 6 weeks to arrive in the mail. You can also check the status, as you can see here, by logging into your My Social Security account and checking it there. I also recommend hitting View and Print your receipt right here and just printing that off just to have it for your records. But again, like I said, you can check the status of this on your My Social Security account. And like I said, card's going to be 4 to 6 weeks to arrive. But yeah, it's as simple as that. So you've just enrolled in Medicare, and that thing that took us about 10 minutes. So sometimes it could take a little bit longer, but yeah, it's not bad at all. So there we go. All right, so next steps, like I said, are going to be you can check your My Social Security online account, the one you created or the one you already had, to check the status of your Medicare enrollment. Generally, it's going to take 4 to 6 weeks for your red, white, and blue Medicare card to arrive. Now, if you enrolled in Medicare Parts A and B, when you get that Medicare card, I want you to contact me, because we are working in a time-sensitive situation then. Because, like I've said before, once you get your Medicare Part B, you have a 6-month window where you don't have to be exposed to medical underwriting, which means the insurance companies are not allowed to know about any health conditions you may have, and you can get a preferred rate on your Medicare supplement. So this is the time, once you get that card in, this is when you're going to contact me. I'm going to guide you, and you're going to pick which direction is right for you. So whether you think you want to go down the Medicare supplement with prescription drug plan route, or whether you want to go down the Medicare Advantage route, you're going to choose that. I'm just going to help you with the options, and then you're going to be the one that chooses the route you want to take. But again, like I said, with the Medicare supplement, we are working with a time-sensitive window, because you only have 6 months after your Part B effective date to get a Medicare supplement at a preferred rate with no medical underwriting. So just contact me once you get your card in, and then we will guide you in the right direction. You'll make the decision, and I will make sure you're well taken care of. So, all right, look forward to talking to you then.